So welcome everyone to Huddle Chats. These are 30-minute monthly events that I have with industry experts to talk about key trends in healthcare. I'm Jared Dashevsky. I'm co-founder of Healthcare Huddle, a weekly healthcare newsletter discussing trends from digital health to policy to business for 30,000 plus physicians, providers, and health professionals. I'm also an incoming internal medicine resident in New York City. I start in a couple of weeks, so I'm enjoying my last weeks of freedom. Today's Huddle Chat will be Streamlining Healthcare Workflows with GPT. And before introducing my esteemed guests, I just want to give our sponsor, Doc.Health, a shout out and the floor to speak. So Doc.Health is an administrative hub for care teams. They're focused on streamlining administrative processes and improving patient care. I have a master's in systems engineering, so all I do is think efficiency. So I'm happy to have Doc.Health, who aligns with my values, sponsor this event, and I'll give their CEO and co-founder, Dr. Michael Doctor, the floor to speak. Michael?
Thank you, Jared, and really great to be here. Appreciate just being part of this experience. I mean, this is just as a side note, GPT and sort of this entire world of large language models and AI has just been an amazing thing to watch unfold really over the course of like weeks and months. I've been following technology for a long time, and I think we would all agree we haven't seen anything like this. Why it's relevant, I'm a gastroenterologist by trade. Started Doc.Health out of Boston Children's Hospital really to help solve my own pain point, which was managing all the administrative tasks associated with good patient care. And I think what's super exciting about today's very relevant topic is that, a lot of these, what we would think of as administrative workflows are things that we are doing very manually in email, Excel files, Post-it notes. A lot of this stuff, this sort of chasm that exists between the electronic health record and all the administrative tools that, again, are faxes and paper and very manual based. Suddenly, like this fire has been lit where a lot of these things can now be automated in our world outside of healthcare. And so what I'm excited to listen to Dereck talk about and the work at Glass and the sort of clinical decision support lens is like, how do we bring this stuff into the administrative support realm? And for us, the vision for Doc is really to be that administrative hub where we're anchored into the clinical systems, we're doing workflows and we're doing smart flows, on all the sort of downstream administrative tasks associated with patient care. Thinking about, certainly we talk a lot about and are thinking about all the ways that we can leverage these large language models and AI to better understand what are the tasks that need to be done to ensure good patient care. How do we automate as many of those tasks as possible? And so I thank you for bringing us here, and I'm super excited to learn more. And I'm sure we'll have some questions and answers that maybe we can contribute to at the end. So thank you.
Oh, thank you. And I'll post more information about Doc.Health in the follow-up email to this chat. All right, quickly, before I introduce Dereck, some ground rules. Everyone stay muted if you can. This chat will be recorded and posted on YouTube after as an archive. Emoji reactions encouraged. My team will post a Slido link for you to ask questions, and we'll do a Q&A about 5 minutes until the chat ends. And lastly, stay curious. All right, without further ado, let me introduce to you Dr. Dereck Paul. Dereck is a resident at Brigham and Women's Hospital. He's co-founder and CEO of Glass.Health, a medical knowledge management platform and clinical decision-making platform that's, you guessed it, backed by artificial intelligence. Dereck decided to take some time off from residency to focus solely on Glass.Health. Glass.Health is a platform that I've used in medical school, that I will continue to use in residency, and that's being used by tens of thousands of other medical students, residents, and physicians. And I'm bullish on them, and I do think every physician will be using Glass.Health in due time. So Dereck, thank you for joining me today.
Thanks for having me, Jared. It's super exciting to be here. I think when we met, we got to just chat a little bit about this very exciting time that we're living through and some of the specific challenges and exciting opportunities around it related to healthcare. So yeah, excited to dig in.
Yeah, so let's do it. I think I'm going to assume everyone on this chat is has a different level of understanding of like the large language model space, generative AI, like AI as a whole. So do you want to just give a brief overview of this generative AI large language model space that has become so prevalent over the past 6 months?
Sure, sure. So I think I think it was the fall, probably like November or October, you had ChatGPT kind of really take the world by storm. This generative pre-trained transformer. It's an AI model that's seen petabytes of information, the C language specifically. And then what it can do is it can receive an input in language, and then it can give you an output. And then that output, it's trying to predict what a human would say based off of having seen a tremendous amount of text. And I think the interesting thing at this moment is that OpenAI trained this model on so much information, and then additionally did human reinforcement training where they go and they say, this output's not so great. Here's how it could be better. They've done that really extensively, that they created this product, this chatbot that just has been really extraordinary. I think one of the big pieces of why this is such an important moment is that they have kind of emergent logic and reasoning abilities, and so they can do very complex tasks. So I think what we've seen in sort of, I'm here in San Francisco now, in Silicon Valley, broadly, is Microsoft and Google and everyone else realize, whoa, the way we can traverse information is dramatically changed right now. Instead of doing a traditional Google search where you say you want to plan a vacation, right? Instead of doing traditional Google search and being like, let me search for what flights there are, and then look at all those flights, compare them to one another, and decide to book that flight. Now with ChatGPT and the Expedia plugin, you can say, find me a flight to Hawaii on this date for this amount. And a large language model can interact now with actually the internet, and sometimes these special plugins to not only find that information, make some of those decisions for you, but now actually execute on some of those things. So that's like an extraordinary place from where we were like a couple of months ago. That's extraordinary progress. And I think why all of us are here is that this change in how information can be traversed has implications in healthcare. You sort of ask yourself, well, what's the equivalent of doing what I just described in terms of booking a flight in healthcare? And things get really exciting really quickly.
Yeah, completely agree. And certainly we have very smart people in healthcare like you who are figuring out how to apply the GPT to healthcare processes. And in Sunday's Healthcare Huddle newsletter, I built a little market map of some companies that I've been following, and this all happened within 6 months of GPT's launch. So like it's truly taking off quickly. And the reason why I wanted to have this huddle chat is because the people in healthcare need to be on top of their game so that we don't fall behind other industries as they adopt this AI technology. So some new companies I've been following are Deniify.Phrase.AI. Existing companies launching AI-backed platforms include Glass, Nabla, Doximity. And then we have strategic partnerships between huge healthcare organizations like HCA, Epic, University of Kansas Health System, with technology companies like Microsoft, Augmetics, and Abridge, because everyone wants a piece of this AI pie, and they see the potential to save costs and to improve patient care with this technology. So from my standpoint, about to start my clinical career, it's very exciting. And one of the things I'm most excited about is Glass. So could you tell us about Glass.Health as a whole, and then talk about the newest feature, Glass.AI?
Yeah, absolutely. And I totally agree with you. It's interesting to see that laid out on that map, because it just sort of suggests how much serious movement there is.
Oh, yeah.
And I think so there's these things of like hype cycles in Silicon Valley, right?
Yeah.
and sometimes the hype cycle, it's not real. It's something that's going to end up kind of being a flash in the pan that everyone's going to get excited about. Maybe even some companies will raise money. Folks will get really excited about it, and then it doesn't prove out. And then, of course, sometimes you have these actual, real transformational moments where there's a new technology that allows there to be many new products and companies to be built on that. And of course, you could think about like the computer coming online as like a big platform moment. You could think about the internet coming online as a big platform moment. You could think about mobile coming online as a big platform moment, where all of a sudden a bunch of companies that could not be built before can all of a sudden be built, and a bunch of products that were not possible before can be built. And I think that's similar to what's happening right now with these foundational models from Anthropic and OpenAI and others, is that it allows us to build things that we could not do before. And it feels like a real inflection point. So Glass is involved in that. And Glass is a platform for medical knowledge management and AI-assisted diagnosis and clinical plan generation. I co-founded Glass when I was a medical student at UCSF. I was friends with my co-founder, Graham Ramsey, for several years before we started Glass. We kind of bonded over just how analog a lot of the tools that are available to clinicians are. I started off in the San Francisco VA, and I was kind of going like, I know in other industries, folks have fantastic, state-of-the-art tools to do their work. Isn't this work at like the kind of work that should have fantastic state-of-the-art tools? And that just kind of got us in a conversation about what it would be like to be a company that built for doctors. And we didn't jump in right away because it's extremely hard space to be in. Healthcare is extremely hard space to build a company. It's expensive. There's a lot of regulation. It's a very conservative market. There's a lot of reasons why folks end up going and building consumer apps or different things with their abilities and talents. But Graham and I are both very dedicated to healthcare, and he built a telemedicine EHR at PlushCare, which was then acquired by Accolade, and then was really an architect of the fertility hormone tracking dashboard at Modern Fertility, which was then bought by Roe. And really what ended up happening for us was we were at the height of the pandemic, and then also both going through these two transitional moments. And we asked ourselves, like, how important do we think this problem is of being able to fight the documentation burden and burnout, being able to increase diagnostic and treatment accuracy? And we reached conviction on that. So founded Glass in 2021. And actually, we're kind of in the startup desert searching for a little bit. We worked on some different solutions that tried to solve problems inside the hospital. It was really hard. We didn't have a lot of money, and ended up, through talking to a lot of clinicians, realizing that folks were keeping Evernote libraries and OneNote libraries and Google Drive, where they're trying to keep all the medical information that they encounter through their career in one place. And then we dug in a little bit deeper. We tried to understand, like, why were people trying to do that? It's because they want to be the best clinician they could be. And they're fighting their own human limitations of that, right? So they're trying to capture the morning report and the noon conference and the tweetorial they see and the podcast and the curbsiders. And they're trying to bring that they're trying to sort of consolidate their learning, have it in one place, and then have it sort of improve their own abilities to do really great patient care. And we're like, whoa, this is really cool. And this is really interesting. And it's very unlikely that Evernote or OneNote or any of these generic note-taking tools, Notion, would turn around and build a great platform to be your external brain as a clinician. So we launched Glass. We didn't actually launch Glass. We posted a screenshot of Glass on Twitter.
Yeah, I remember.
You remember that? We thought we'd get 10 beta users, and we ended up getting like 500 requests for it in our DMs in 48 hours. And we're like, oh boy, this is something that's really interesting and important. So the original product Glass Notebook was that external brain for yourself to help clinicians sort of perform at their highest level and get these great patient outcomes that so many folks who are dedicated to doing. And this lifelong learning that is so much part of our culture to support that. And essentially what happened to Glass was that we got invited to join Y Combinator, which is fantastic, fantastic accelerator program. They were sort of early money into DoorDash and Airbnb and Dropbox and Reddit and Instacart. And that coincided with the launch of the GPT-4 models. And because we were part of YC, we had early access to them as well. So Sam Altman was the previous CEO, CEO of OpenAI, is the previous president of Y Combinator.
Wow.
And so there was a relationship there already to start to work with some of these models early on. And both Graham and I were skeptical, but what we ended up finding was, wow, large language models could help our users do what they're already trying to do, which was diagnose their patients, come up with great clinical plans, get that documentation done, and everybody go home. Go home to your kids, go home to your dog, like sleep, eat, right? Because we spend so much time doing this work and doing documentation. And so that was a really exciting opportunity that we felt like we couldn't give up. And that's now really the main focus of what we're doing at Glass.
Yeah, I just wanted, it's just fantastic, the platform. And I wanted to show everyone, I took some screenshots of what it looks like. This is it, yeah. So like, if you go on, you can basically input your patient's one-liner, right? So one-liner is like 65-year-old with XYZ, past medical history on this medication. And then if you click the generate, and then it processes, and within seconds, it will spit out a differential, and it includes references, and these are valid references. I think one of the challenges of ChatGPT is that it spits out nonsense references, but these are valid references. So it can output a differential, and it could also write you your assessment and plan, which is, the most important part of the documentation physicians do. And for me, throughout medical school, I used to carry around like pocket medicine. Do you know pocket medicine?
Yeah.
I bought it on Amazon. It's like, it fits in my pocket. And a patient, like if I'm in the ED, a patient that comes in chest pain, I go to, acute coronary syndrome, and I look, okay, what's the differential? What should I miss? What can I miss? What is the workup? So Glass.AI is basically automating that, and also reinforcing or backing up the plans with references. And it's very resourceful. And I imagine one day it will be the new pocket medicine.
Well, actually, can you go back to to your first screenshot? I didn't know you were going to share these screenshots, but I'm excited now, and I'm just kind of like, as I'm seeing that, I'm so proud of the teams that put this together. But if you go to the next one, actually interesting, because I think pocket medicine is referenced, MGH pocket medicine, and there. So the way what's happening is that a team of clinical contributors, we have this really amazing, fantastic team. A lot of folks who are coming to us from doing work at CP Solvers, which is also referenced there, other major medical education podcasts. These are really like those kinds of people who just have medical education in their hearts.
Yep.
Like those are the people that are behind these kind of outputs. And what's happening is you're seeing the references that were used to train our version of GPT-4 to handle chest pain. That's what you're seeing here. Because we've basically, I'm gonna use the word trained kind of broadly, but sort of trained a version of GPT-4 to go and how to have a guide of how to think about chest pain. And then if you go to the next one, I think what's really interesting here is that, if you just ask ChatGPT what is the plan for this patient, you might it might say sort of like EKG or troponin, but it wouldn't give you the kind of specificity that's here in this plan. And I hope that a lot of people would look at this plan and go, whoa, this looks like a really great resident who's well-trained wrote this. How did they do that? And it's because a really good, well-trained residents taught this model how to do it. And here's the sources, the primary sources that they're using. We don't hallucinate references because the references are not being generatively created. They are sort of in a different database, and we keep track of what was used to train the topic. So you're again seeing sort of the references for the acute chest pain plan, which interestingly are different than what you would use to think through chest pain. When you're thinking through chest pain, you're using schemas from, that was trained using some of these other resources. This is here a lot more about what is the evidence-based treatment. So anyhow, I think this is really fun to look at.
Yeah, I mean, it's fun to use, and it will make any resident or medical student look great. And this won't replace, I mean, in my view, this won't replace the skills of a physician, but it will help augment and improve patient care, because physicians, especially residents, are managing 10 plus patients. It's very, very easy to miss something. And if you have a co-pilot like Glass.AI that's saying, oh, don't miss, rechecking the troponin in 3 hours, right? Like that benefits patient care. So it is very exciting. So Glass.AI is in the beta phase. Where's it going after that? Or what's the goal?
Yeah. So there's kind of two challenges here, or sort of the way that we think about it is two big challenges. One is, how do you have a really great clinical large language model that gives you great clinical outputs? That's just on its own, that is a big challenge.
Mm-hmm.
The second question is, how do you leverage that to solve problems? And there are a lot of different problems to be solved in healthcare, some of which large language models will be great for, and some of them that, that's just not the right solution for the problem. But we realize that our users, they really want to be fantastic doctors in the way of, like I said, high diagnostic accuracy, an ability to deploy great evidence-based treatment plans, and that was really at the heart of being a clinician. And so one aspect of it is continuing to train the AI to be really, truly clinically excellent. So we do this kind of go topic by topic, which is our strategy. Our clinical AI strategy is a little bit different than what other folks are doing. You can imagine some folks are maybe training on lots of EHR data, or they might be doing reinforcement training in a different way. We go topic by topic to give the AI the right context that it needs to create these plans. And actually, it's maybe more similar to how you would train a person, right? Than train an AI. Is kind of go topic by topic and say, here's how you should think about this, and then test its ability to do it, and then make adjustments from there. So just training on more topics and sharpening the differential diagnosis. We want this thing to be able to knock out like the New England Journal CPC. Like, we would just submit the whole thing and it'll knock it out. So that's where we're going, where it can handle topic coverage that's similar to UpToDate's coverage, where it can diagnose cases at basically should do diagnosis like the AI plays chess, should do a very, very high level. That's kind of the clinical AI strategy piece of things. And then the product and the problem solving piece of things, we think the future is, let's say you're on a cardiology service with taking care of 20 patients, hopefully Glass can help you knock out the first draft of 18 progress notes, one discharge summary, one admission note, or whatever that is. And help you do that at a higher level than you might have done it just by yourself. You're absolutely right. We think of it as a co-pilot. We think of it as an assistant. I would say think of Glass as kind of on the trainee level, something you want to supervise, something that can take the first draft of your note that you need to go edit and attest. But we're going to get more integrated into workflows so that we can just give more horsepower and provide more value.
Yeah, I'm super excited to see where Glass.AI goes. And I'm about to start residency, but as a medical student, I spent so long thinking of differentials, writing notes. Like, I understand I had to do that just for the learning experience. But I only learned that I wasn't creating the correct differentials when it came time to present at 7 a.m. the next morning. And I look like an idiot. So I'm looking forward to using it once I start residency, where it'll be the real show, and I won't be just a medical student. And so outside of Glass.AI, where do you see GPT having the biggest impact in regards to workflows?
Yeah, well, I don't think that much about the world outside of Glass.AI, which is, you won't be surprised by that.
We're focused.
We're pretty focused. The way I sort of think about it is try to go first to what's the problem that you want to solve, and then ask yourself, what are the right solutions? We did not start using large language models because of the AI hype cycle. Okay. What happened for us was that we were trying to solve a problem, and this new tool came online that could help us do it, and so we went for it. I think there definitely are a lot of places where this is going to be great, and maybe one of the ways to think about it is what problems currently interact with language, because that's where a lot of this new power is. So when it comes to messaging with patients, or that's obviously a place where Epic and Microsoft and a lot of folks have their eyes on, because there's a lot of time spent managing inboxes. So folks are pretty focused there. Mm-hmm. I think that's going to be exciting. I think that's going to give folks back time. We're a little bit more focused on these heart of medicine diagnosis and treatment plan pieces of things. The other thing is, you were talking about being a medical student and then going into your pocket medicine, looking that up, and then from there trying to go and create a plan. The AI is kind of doing something similar. It's just doing it more efficiently and faster. And so that ability to traverse knowledge in a different way, that has a lot of implications, right? So you can think about clinical reference broadly, and there's a lot of the big clinical reference landscape. Think about Lexicomp, think about MD-Calc, think about UpToDate's one of them. So I think probably these large language models change our ability to interact with clinical reference broadly across all of that, pharmacology, sort of the entirety of what we know, medical calculators, things like that. So I think you'll probably see transformation in that, and then you can imagine from there getting to a place where you get proactive insights, right? Where it's not just you telling the AI, hey, here's my patient, here's what's going on, but maybe the AI is watching as you admit someone and starting to make suggestions or starting to suggest a plan. So, but those are all along sort of a spectrum that's probably going to play out over the next couple of years, in terms of how do you, this AI can interact with information and data in a way that it's very hard for us as humans to do, right, and can assist us to take the best possible care of our patients.
Yep. And in regards to the last thing you just said, Dereck Paul wrote a recent newsletter on GPT and what it can do. And we just said checking labs and being proactive. And he included this graphic in his newsletter where basically you have EHR, audio, text, patient's glucose is too high, you get an alert that says insulin's required, physician says why, and it says like, oh, or potassium's too high, physician says why, oh, to correct hyperkalemia. And it's basically like a guardian angel, right? Where, you are checking the labs, but you can't do it 24/7. And this clinical decision support system that has GPT integrated can keep track and communicate labs and decisions that you need to make to you, which I think is very exciting and without a doubt the future of medicine in regards to these AI capabilities. Before I open it up to questions, and we have some rolling in, do you want to add anything else? Anything else you think the audience should know about GPT or Glass.Health?
I think it's an exciting moment. I think there are a couple of places where sometimes Glass is misunderstood, and we've talked about them a little bit. One is that sometimes folks will think that it's a patient-facing kind of symptom checker, which it's not. It helps a clinician broaden their differential diagnosis. It helps draft documentation, and it's really meant to be an assistant to the clinician. Sometimes folks think we're trying to replace clinicians. Like you said, that's not our objective. It's not something that this is very clinician in the loop, sort of enhancing, kind of making super clinicians really is the idea. And the last thing I'll say is that I think there are a lot of great concerns about accuracy and bias. And I think those are some of the most important things that we need to work on. They're the things that I think about the most, or things that kind of like keep me up at night. But one of the things that we're seeing early in our explorations at Glass is there's actually an opportunity there's really going to be an opportunity to enhance safety and enhance accuracy. And I'm very hopeful that there will also be an opportunity to improve equity too.
Yes.
So you can even imagine training an AI to, for example, do health equity alerts and go, hey, actually, this patient is at risk for this disparity. And here's what you should know about it. Here's the study.
Right.
I think it's going to be, I'm so excited about that, because certainly a lot of my medical school work was in sort of health equity research. And I think there's an opportunity for us to bring our best selves to this and see some really extraordinary things happen. For sure.
It's going to be very exciting. And I just want to share one quote I included in my last newsletter from Dr. Thomas Fuchs, who works at Mount Sinai. He's the chair of AI. He said, in healthcare, patients are currently losing their lives not due to AI, but due to the absence of AI. So I think the future is bright, and I'm excited. So a couple questions. Let's see. Here's a good one. What are the regulatory barriers to using Glass.AI, for example, with clinical data? How would this data merge with pre-existing notes and records? I guess if it's integrated into an EHR.
Yeah, so the regulatory space is kind of a moving one. Right now, there's certain types of clinical assisted devices and diagnosis that are regulated. Specifically, there's regulation around using imaging. Specifically, there's regulation around diagnosis when there's not a human in the loop. I think right now, Glass more falls into the category of a clinical reference. Mm-hmm. So it's like an UpToDate or Dynamed. It's just like a really smart textbook.
Okay.
But it is starting to be a really smart textbook that's interacting with the clinical context. We have clinicians de-identify their one-liners because the name, the MRN, the date of birth, it's irrelevant to us. But that produces a lot of friction in sort of the ability to interact with the large language model. So I think there'll be different things that happen. I think as we move into being more integrated into patient workflows, maybe pulling previous notes like this person's asking, right? Let's say somebody's been in the hospital for 60 days. If you want to pull all those 60 days and use that text as context to draft a discharge summary, you're going to be interacting with a lot more information. You're not going to be able to just easily strip away the identifiers into a one-liner. There's a tremendous amount of information there. There's a lot of HIPAA compliant information that needs to be used there. And then, on the pure regulatory side, I kind of expect that there'll be something from the FDA. It's really hard. Nobody saw this coming, right?
No,
Like
yeah,
large
so
language
quickly,
models.
6 months.
Some people saw it coming, but the FDA
Okay.
probably, didn't think it was coming this fast or this strong. So they sent up a little bit of smoke saying they're looking really seriously at that, at this. And I think that'll be good, for a company like Glass, who was sort of early out. We can go, all right, what's the validation that we need to do to get to the other side of that, of a new kind of regulatory sort of obstacle. Obstacle is not the right word, because I think these things are good, but I don't have a better word right now. So, new regulatory obstacle, get the other side of it, and then that's also good for us as a business. So, but I think TBD.
TBD. All right. And then I don't want to keep everyone, but ask one more question. Based on talked about workflows. So thinking about integrating Glass.AI into the clinical workflow, what needs to be changed in the existing workflow? How easy or hard is it to make these changes?
It's a great question. My co-founder, Graham, is he's actually probably even better person for this question, because he's just such a great product mind.
Mm-hmm.
And I think when we think about product, it's a dance between the design and the limitations of the technology and the users and what they want to do already. And so I think my answer is I don't know. It's something that kind of gets figured out through a process of shipping product, listening closely to the folks who are using it, iterating on that, and then this sort of ongoing dance and execution of delivering products to the market. So, one thing I will say is that when we talk to enterprises, big hospitals, they really want to see Glass go from where it is right now, which is sort of a standalone platform, which you bring information into it, to something that's integrated with the EHR, to something that doesn't take folks too far off their flows. And so you can imagine interacting with Glass inside of the EMR in a more seamless way, or interacting with just general clinical intelligence in a more seamless way. I think there's also the potential that the Glass platform will be expanded. So both be expanded and integrate with the EHR, so that you can bring more of your patient into Glass to get AI insights and to sort of do AI functions on that patient information. So another time where I'm kind of saying TBD, but I think it's going to be really, really interesting, exciting couple of months ahead of us.
All right, great. Well, Dereck, thank you so much for taking the time to chat with me about Glass.Health and GPT. I think this is all very interesting. Thank you to Doc.Health for sponsoring the event. And if anyone has any follow-up questions, I know we didn't answer all of them. You could email me. I could try to answer them. If not, I'll get more people to help, better brains than I have. But yeah, thank you, everyone. Thank you, Dereck. Thank you, Doc.Health. And stay on the lookout for more Huddle chats coming in the third quarter of this year. Thank you, everyone.
Such a pleasure. Thanks.